if you feel like your kiddo can't see the board, we go to the optometrist. We want to make sure that we've got choices and tools for those eyes to level the playing field as far as the visual information is concerned. As soon as an auditory processing challenge is suspected, I don't think you can ever go wrong with just getting information. It helps better understand that student, it helps the parents, it helps the teachers, it helps others around them. Supports are not as effective as they should be if the diagnosis is wrong. So I think it's really important to get accurate information for these kiddos, which can be tricky because of that overlap. But for our kiddos, if they're perceived as being lazy, unmotivated, they're being told your hearing's just fine, try harder. It's not helpful, and it can be even detrimental to their success and self-esteem.
Welcome to the Individual Matters podcast. Today we're chatting with a very special guest, Dr. Megan Locke, Executive Director and Audiologist with Able Kids Foundation, a Fort Collins-based clinic that opened its doors in 2006 to continue the work begun at Colorado State University over 50 years ago. Dr. Locke and her team work with clients of all ages, from children to adults, to assess Central Auditory Processing Disorder, or CAPD. Thank you for your time today, Dr. Locke. We're especially excited to have you on as a guest because, as you know, our pediatric neurodevelopmental evaluations frequently identify signs and symptoms of possible CAPD, and we often make referrals to Able Kids. We always hear very positive feedback about the work you do. We feel so fortunate that Able Kids Foundation is right here in Colorado, and it's great to have you on to share some of your knowledge and expertise with our listeners. We're talking about Central Auditory Processing Disorder today, but maybe you could just offer an overview of what auditory processing is. This may be familiar to some of our listeners, especially if they're teachers or clinicians or maybe parents with kids who have been assessed, but I think maybe a lot of our audience doesn't really know what auditory processing is. So generally, can you talk to that?
Of course. Central auditory processing challenges are when an individual has excellent hearing. The mechanics of their ear are working great, but they have to work harder to actually understand that information and to filter out background noises. CAPD is very common, yet underrecognized and often misdiagnosed. There's a lot of opportunities for misdiagnosis and underdiagnosis of CAPD. I think one of the reasons is there's a huge overlap between CAPD and a lot of other diagnoses, including ADD, ADHD, autism, anxiety disorders, sensory challenges, dyslexia, etc.
That's great. Yes. And I'd like to get into a little bit of that overlap and how a central auditory processing disorder might affect those or how they look the same. So that would be great. So just, it sounds like you're saying that auditory processing is much more than just hearing. It's the brain and how the brain and the ears talk together. Is that right?
That's right. Yeah, when most of us think about our ears, we think about just that hearing piece. And we're often taught and we often think that if our hearing is great, that life is easy, but that's not always the case. Again, just because we hear it doesn't mean we always understand it. We can actually mishear what we're hearing, even though our hearing tests are great and normal. And then the other thing that some individuals don't realize is that our world is actually really noisy. And for some individuals, their systems lack the ability to filter out that background noise. And so they're getting bombarded all day, every day, which is exhausting. I liken it to wearing an itchy tag all day. And you can't take that shirt off. That the noises or that tag, it just can constantly grate on that central nervous system, just making it harder to perform in your academic environments, work environments. It can affect social relationships, even at home, self-esteem, overall well-being.
Of course. Yeah, no, that all makes sense. And we focus mostly on kids, but I know Able Kids Foundation works with individuals of all ages. So when you talk about sound discrimination, maybe having good hearing, but being unable to sort out what's relevant from the background noise, my mind automatically goes to the child in the classroom, but it affects adults as well in social situations, right?
It does. There's several different causes of CAPD, one of them being genetic. So oftentimes we end up evaluating parents after their children have gone through the process because light bulbs start going off. And as we parents know, sometimes the more we learn about our children, the more we learn about ourselves, which is an unexpected blessing, I think, to becoming a parent. But yes, for adults, a lot of them may have struggled in school, not necessarily with grades. You can be very successful and have CAPD still, but there's those common threads of, lecture classes were exhausting. I really needed copies of notes. I was so tired at the end of the day that yeah, I didn't always have the energy for, seeing friends, extracurriculars, things like that. And adults that we see now, they often talk about how they're so spent after their workday that they don't necessarily have any more gas in their tank to spend with their families, or they're more irritable than they feel like they should be. The pandemic was interesting, when a lot of people were given the chance to work virtually, all of a sudden a lot of our adults went, oh my goodness, it's so much easier when I get away from the chaos and the noise. I'm more efficient. I'm getting my work done more easily. Maybe the quality of my work has improved. And gosh, I'm not so tired at the end of the day. So it can affect adults in the same way. We're just in different environments, and the tasks that we have to do maybe a little bit different than our students, but we can still work a lot harder than we should have to as adults to connect in a meaningful way during our day.
Of course, we visited with you several years ago, and at that time, many of the information you shared stuck in my head. And to this day, I think about adults who may be out at, say, a restaurant or in some sort of a social situation. And of course, we think about introversion and extroversion and those kinds of things. But for adults with auditory processing challenges who are in that loud environment, I remember you sharing that they get irritable, and it's not a very fun experience, and it looks differently to those around them than maybe what they're really going through.
Yeah, they can appear to be rude. If you're having trouble following streams of conversation because the noise is impeding your ability to do that and you're not engaging. A lot of our adults, just like our students, get put in categories that they don't belong in. Rude, not interested, not good team players, things like that.
So for children in particular, I'm getting a little bit ahead of myself, but what are the signs, the typical signs or symptoms or characteristics in children, maybe in a at home or in a classroom? What are the things that somebody who knows a little bit about CAPD can look for to identify that something might be going on here?
Sure. Individuals can present differently depending on their environment and maybe other strengths of theirs. But we looked at a group of 100 individuals a few years ago, and this information is on our website. But we really wanted to kind of chart the most commonly reported behaviors in our clients. I think, sometimes individuals try to put CAPD students and adults in a box, and we can't do that. If we're looking for the exact same thing in everybody, we might not see it. It might be there. It just may be that student has figured out how to compensate in third grade and it's not going to present till sixth grade. But some of the top reported behaviors: easily distracted. Just the presence of sound can make it harder for an individual to focus on not only auditory information, but their work. So at home and at school, difficulty completing work, trouble staying connected when the teacher is talking. And this might be zoning out. It might be chatting with their friends. It could be a variety of behaviors that present when this happens. Many of our students report sensitivity to loud sounds. Actually, 80% of the 100 did. One of the most common misconceptions of CAPD, I think, is that everybody covers their ears. And this isn't always true. As a society, we know that that's not often a socially acceptable behavior. So a lot of our students muscle through this, but sensitivity to sounds can also mean I hear the pencils in class, I hear the clocks ticking. At home, we have a lot of students talk about how when they're doing homework, maybe at the kitchen table, they hear their pets walking by, and their siblings talking and things like that. So remembering that just the presence of sound can be louder and more disruptive to these individuals. Mishearing is a very common characteristic. Again, just mishearing one or two words can change a lot. Sometimes individuals don't always know they're mishearing. They heard what they heard. Problem is, it doesn't always match what the speaker said. So a lot of times we might get, my teacher never said that. I saw an adult recently at home. His wife is saying, we talked about this. And he's saying, no, we didn't. So if the information doesn't land, there's no information to hang on to. But sometimes we don't always realize that the individual we're talking to is not understanding everything we're hearing.
I would
Anxiety.
imagine. Oh, sorry, go ahead.
Yes. No, I'm sorry.
I would imagine that
Anxiety.
resonates with a lot of our adult listeners,
Yeah.
what you just described. Yeah, all not not hearing in conversation with their spouse or their coworkers or their boss something that was said, and then how that might appear to the other person if they don't understand what's going on. And similarly, many of the symptoms that you're describing in children, I'm thinking about ADHD questionnaires, sensory processing questionnaires, even autism spectrum disorder questionnaires,
Yes.
and many of the signs and symptoms of that. And it sounds very much like what you're describing.
Yes, there's a ton of symptom overlap, and I really encourage parents and professionals when they're trying to tease out, what's what. Um, Characteristics of CAPD often can vary across environments. So, we might see or hear, a child does really great one-on-one. They get the information and then they fall apart in the classroom. And sometimes it may seem like that child's being inconsistent, but actually their behavior is quite consistent. What's changing on them is the environment. So, when you look at some of these struggles that some of these kiddos have, I really, when we talk to families, love asking, how they do in certain environments because it tells a really good story where characteristics and traits due to ADHD, research shows are more, they commonly present across environments. Again, same with autism disorder, sensory processing challenges. So it's really that noise piece and the acoustic environment. And what makes it tricky, Andrew, is that if your system is efficient, you might think that classroom's quiet. We hear it all the time. The teacher says, I just don't understand why this kiddo can't focus. The classroom's really quiet, and it may be for them. But what they don't realize is that child's hearing the teacher next door, the commotion in the hallway, the shuffling in the classroom. So I liken it to vision. If you don't need glasses to see the board, it doesn't mean that a peer doesn't. Our systems are all different.
No, that makes a lot of sense. I Yeah, I'm thinking again about neurodevelopmental evaluation, some of those soft signs, such as when a child is completing a test and they hear the wind outside or a
Yeah.
truck beeping or the clock ticking in the room,
Yes.
and it grates on them. It's distracting to the point that they can't complete the task. Whereas somebody without that struggle might not even be aware of that. But certainly in a classroom, I would imagine that can appear as maybe resistant or oppositional behavior or being difficult or being particular or being inflexible or what have you. Whereas in reality, you're talking about something between the ears and the brain that's going on that's causing this.
Yes. And, it can result in sometimes a couple of things for these students. Sometimes they lose their recess because they didn't get their work done. So they're very confused and frustrated because they feel like they're getting punished for something that's out of their control. But if you don't have this information first, it's really hard to understand what's going on. And then some of them that don't complete their work in class, they have to take it home to do. So their school day is even longer, and they go home and they're exhausted and frustrated, and it can just be incredibly frustrating for them.
Of course. Going back to auditory processing in general, something I had wanted to ask you is developmentally, how does that look? That begins, I would imagine, very early in one's life. Does it peak at a certain time? Does it resolve if there's a deficit, or kind of how does that look across development and the lifespan?
Yeah, so it's hard to give a definitive answer on that. As I mentioned, CAPD can be genetic. It can also be acquired due to a head trauma or another condition. The central auditory nervous system is a maturing system. It typically develops to adult level function around 10 to 11 years of age, but at the foundation, we've seen that the system can continue to mature throughout the 16th year. I have evaluated a few individuals during my career that did mature out of this. That has not been the norm, but some individuals do outgrow this. I suspect, based off of the feedback that we get from families, that the majority of our individuals have a genetic component. And for those students, I would suspect that their system may continue to mature and get stronger, but they might not fully outgrow it. What we have to be mindful of is that just because the system's stronger when they're in high school, it doesn't always mean that life is a lot easier for them because the lecturing ramps up, the auditory demands ramp up. So as the demands increase on the system, it can still make it much more difficult for that student to perform to their full potential, whatever that may be. So it's a hard one to answer. Like I said, some may outgrow it. We know that some do not. And, our feeling here is, if you feel like your kiddo can't see the board, we go to the optometrist. We want to make sure that we've got choices and tools for those eyes to level the playing field as far as the visual information is concerned. As soon as an auditory processing challenge is suspected, I don't think you can ever go wrong with just getting information. It helps better understand that student, it helps the parents, it helps the teachers, it helps others around them. Supports are not as effective as they should be if the diagnosis is wrong. So I think it's really important to get accurate information for these kiddos, which can be tricky because of that overlap. But for our kiddos, if they're perceived as being lazy, unmotivated, they're being told your hearing's just fine, try harder. It's not helpful and it can be even detrimental to their success and self-esteem.
That all makes sense. And we'll get into how you go about assessing CAPD in just a moment. Going back to our conversation about development and identifying signs and symptoms of a possible CAPD and then making a referral to someone like you for more in-depth evaluation. What I want to ask is typically how often or do you know how often children are assessed for just their hearing? Who as a child grows older assesses hearing, and when in their development or in their schooling would suspicions about a possible CAPD, and how would those arise?
Yeah, so schools will often screen for hearing, but it doesn't test the central auditory nervous system at all. So again, these students often get a pass on the hearing test, whether it's a doctor's office or the school testing. But there's no information gleaned from these procedures on how the system actually takes in the information, understands it, and filters it. Um, I it can present differently at different times for individuals. And like I said, I think that is determined by a variety of factors, just individual personality, how much you can handle stress, what other pieces are on your plate, other strengths you have to mass. So for some individuals, it presents itself very clearly at 3 and 4 for parents. For others, it might not be till middle school, fourth, fifth grade, sixth, ninth, and then college are some of those kind of key transition times where we see the demands shift. And sometimes we see kids that have been homeschooled, K through 12th grade. You have a ton of flexibility in the homeschool environment. You have a lot of control over your environment. And so maybe you've had central auditory processing challenges, but it's not really presented because the system hasn't been challenged. Central auditory processing challenges present when there's a less than optimal listening environment. The system's not challenged in a quiet environment. So, sometimes individuals go to college and they go, oh my gosh, what happened? What's wrong with me? And I'll say, nothing's wrong with you. It's just your environment changed. And so you have a few more things to manage now than you've had to manage in the past.
So in addition to those soft signs and symptoms that you talked about, parents or teachers might be aware of a change of an environment or a change in
Yeah,
task demand.
that's right.
And if they see a change in behavior, that may be due to their auditory processing system being taxed in a new or different way.
That's right.
And then also, it sounds like if you're a teacher or a parent and you observe some of these signs and symptoms, but you know the child has had their hearing test and it was perfect or no concerns reported, that doesn't mean that there may not be an auditory processing problem.
No, and I liken it to dyslexia. You can have perfect vision, and still have dyslexia. It's two different things. So a lot of our students have gone through hearing test after hearing test after hearing test and been told, you're fine, hearing's awesome, try harder. And fortunately, those parents are going, I know their hearing's good, but there's just something I can't put my finger on, and they keep researching and things like that. So a perfect hearing test is great. Actually, it means your hearing's excellent. It doesn't rule out central auditory processing challenges, though.
Wow. Okay. Something else I wanted to ask you about was the relationship between CAPD and other neurodevelopmental or mental health disorders, how they overlap. And I don't know how much detail you want to get into about this, but I was just playing around actually with Chat GPT earlier today, and I was putting in some different prompts, and it pulled up all this information about how CAPD can look like ADHD, how it can overlap with symptoms of autism, specific learning disorders, language disorders, anxiety, executive function disorders. And it doesn't really surprise me, but it just kind of reinforces that without a in-depth evaluation, much of this can look very similar. Do you have any
Yeah.
thoughts about, or do you want to talk at all about how CAPD relates to some of the other neurodevelopmental disorders?
Yeah, I'm just kind of going to emphasize what you said. There's a ton of overlap. And it's hard to tease things out until we get some good quantifiable data. And I think, the more I'm in this field and the more I present and the more I learn from others, we have to remember that usually it's just not one thing. It may not be CAPD, but if we've got a kiddo with dyslexia, and the management for dyslexia is helping, but they're still struggling in other areas. That there may be another piece going on. Autism's another big one. I presented at the Worldwide Autism Conference in December. And my point was, a lot of our students that have the diagnosis of autism are told you're sensitive to sounds because you have autism. I respectfully disagree. I would say you have autism and you're sensitive to loud sounds, and you may also have CAPD. Sensitivity to sounds and mishearing are due to inefficiencies in the auditory system. And so, regardless of what other identification has taken place, when you're talking about the symptom overlap, the two that I have seen, and that I believe based off our research and our clinical experience that are due to CAPD only is sensitivity to sounds and the mishearing. The anxiety, the frustration, the distractibility, we know that can be caused by a host of other things. But again, when we're trying to kind of tease out, okay, what's what and what information can I have now to try to determine if I should go dyslexia, CAPD, autism, two of those, like I say, classic symptoms that I think are very characteristic of CAPD are those behaviors due to sound only, the sensitivity and mishearing.
And you talked about, again, why an in-depth evaluation can tease these out. I think immediately about treatment as well. So if the symptoms of an APD or CAPD are attributed to something like ADHD, and treatment takes the shape of medication or other ADHD related modifications, that's not going to fix the CAPD, right? Or if there's
Correct.
a learning disorder in reading or writing, addressing those subject matter skills and the tutoring around that that's not going to improve the CAPD, right?
Correct. It doesn't change the noises. So again, I'll liken it to if you can't see the board and you have ADHD, the medication cannot help you see the board better. It may help you feel better and address the things it can address so that you are more focused and things like that, but there's still unequal access to that visual information. Same thing with the CAPD, all of those other treatments and interventions we see are very helpful. I'm a huge fan of doing the interventions that are appropriate for all the different players, because that's where we can hopefully get the most support for these kiddos. But if those interventions don't directly affect the noises and don't directly impact the ability of that child to be more in control of the noises during their day, we can't expect a kiddo to be able to focus better in class and, understand more easily, things like that.
That all makes sense. We've talked kind of tangentially around assessment and treatment. Can we get into that a little bit? And can you talk about how auditory processing is measured, how a CAPD is assessed, either generally or just how you do it at Able Kids Foundation?
Sure, I'll do both if you don't mind. You have to start with the hearing test to ensure the hearing is good. Again, you've got to rule out that there's any hearing challenges before you look at the processing system. That just takes a couple minutes. The other tasks involved in a CAPD assessment are asking the system to understand what it's listening to. So sometimes an individual might be hearing two different things in each ear, and they're trying to just focus on their right ear, just focus on the left ear. At times, there's speech presented in the presence of background noise, and we're looking at how well that system filters out background noise so that individual can understand the important information, which is speech correctly. Sometimes the information is being split between the two ears, and the task is looking at how well do those ears work together to blend that complementary information. So it's more about, listening and actually repeating back what you're hearing and looking at, okay, according to your age, how is your system understanding the information that you hear very well? And do you fall within the expected range of performance, or are you working harder than you should? I do want to mention that screeners are very easy to beat. Again, when parents call and say my kiddo has normal hearing and they passed a screener cannot rule out central auditory processing challenges. They have their place, but I think you have to understand the limitations of them as well. There's also two parts to the central auditory nervous system, the cortical level and the brainstem. So think of upstairs and downstairs. In a review of over 100 test batteries utilized across the United States, we found that the vast majority only look at the top levels. So a lot of our students are getting missed and falling through the cracks. It's really important if you do have a central auditory processing assessment that it is a full, complete battery looking at the entire system.
You talked about the difference between screening and comprehensive. I know some school districts do auditory processing testing. Do you want to comment on that, or how does that look compared to what you do, or what are your
Yeah,
thoughts?
sure. So I've seen some of those test batteries. In my experience, most of them are doing screeners, not all of them. But parents do share results that they get from the schools. And I think, schools just have limited tools. Audiologists they're not trained well in this in school. An article a couple years ago estimated that in our 8 years of schooling, we get 8 to 12 hours of CAPD experience. So if you're getting tested by someone who hasn't been trained well, that's not their fault. They only know what they know. But if the only tool they have in their toolbox is a screener, again, those kiddos might fall through the cracks. So I have seen some really great assessments from the schools. I've also seen where sometimes the only assessment that audiologist has available is a screener. And again, it's just not going to catch everybody.
Of course. So you're really a specialty within audiology.
We get a lot of training when we join the foundation. We're also very fortunate that we are a continuation of a program that started at CSU. So, we have that background in research. And then this is all we do. We're immersed in this all the time. And I was just telling a young man the other day, he was asking lots of great questions. And one of them was like, how did you learn everything that you know? And I said, we're very fortunate. We've got to had the opportunity to meet many wonderful individuals like you, and we learn a lot from you and from you guys. And you can probably relate, Andrew. The longer you're in a field and the more you listen, the more you really connect the dots and appreciate how much this can impact one's life. So, we know the test battery and things like that, but you also have to be able to connect the test battery to the real world. Because if a child does their job and we've got a great test battery and the cross checks make sense, and we can't help the parent understand what this means for their kiddo, we've done that student a huge disservice because the parents are the kiddo's biggest advocate. Same with an adult. If you go through this testing and you don't understand how this impacts you at home, at work, in your social situations, we've done you a huge disservice. And that all takes kind of some time, as to get really good and have just a wonderful understanding of this area and specialty area of audiology.
That's so well put. So to expand on that, can you paint a picture just kind of briefly about the experience that a child or an adult that you assess would have in coming to Able Kids Foundation over in Fort Collins? So they have an appointment. How long is that? What's involved? What would they expect?
Sure, we say to plan to be here for that initial appointment for 2 hours. The testing is about an hour, but then we do love to give you some information while you're here. It's really important to validate that child. A lot of times, they'll sit there and go, "This is what I've been saying," or "Yes, this is how I've been feeling." And then also for that parent to have some hope and understanding too, that there are some more choices and again management strategies that we should be able to implement in that student's daily environment. So the testing is an hour, then we chat for an hour, then we write a comprehensive report that we love to go over with the parents. If you're local, or we do that in person, we allot an hour. Many of our families are from out of state, other countries. We've seen from all 50 states and 30 countries, so we do a lot by phone. So we're happy to be flexible that way. We love to connect with you at least twice then. We're happy to connect more. We don't charge for that. Again, if you have questions that are going to help your child in the classroom or help you succeed better at work in your home environments, we are always here. That's the whole goal of this process, is to make your life easier. We are known for a filter. We can talk about that later. But one of our management strategies is a custom filtered earplug, and that gets mailed to individuals that are not local. Again, if you are local, you come back and pick that up in about a month.
Wonderful. That's such a great overview. Let's go talk about those filters and any other outcomes of the evaluations that you do. So you'll spend this time with the client, and you'll go over and validate what they've been going through and explain the data, the results of your testing. And then where do they go from there? Do they go back to their schools, or is it just knowledge that they internalize? You had mentioned a filter that can be used. Can you talk a little bit about sort of next steps?
Sure. Many parents do share their report with schools. These recommendations can be adopted into 504 plans or IEPs, and some of them may overlap with other things a student's been getting, like preferential seating, written directions, things like that. But a lot of times we can add to it. So, some really helpful things for students in the classroom, being close to the teacher talking when they're lecturing, access to headphones and earplugs when they need to focus on their work. As adults, we may not realize it, but we typically have a few more choices than our kiddos. Our kids walk around with the group all day long. They never get a break typically from their group. So adults can have a separate quiet office and close the door. Our kids can't do that. So headphones, earplugs allow them to try to create a separate quiet office when they're, trying to do their best work, separate quiet room for test taking, things like that. There are some other strategies that are out there for parents to explore. Again, our other probably our most famous recommendation is the filter. The benefits of the filter were discovered at Colorado State in the early 90s, so it's been around for a little over 30 years. It's the only thing I know of to balance those two ears together. When you have central auditory processing challenges, the ears are out of sync, which is creating chaos in the brain and the difficulty with understanding and filtering out background noise during the day. The filter is the only choice that I know of to say you finally have a way, again, to be in charge of the noises instead of the noises controlling you all day. It is a data-driven recommendation. I actually came to the foundation because of the data-driven nature of our program. That was really important to me because if the data supports it, then you should see a benefit out in the real world too. So everything we do is based off data, which I think just really helps ensure the student is just getting the most support that they can. The filter, if it's found to be helpful, looks like a custom earplug. It's not an earplug. It's worn in just one ear. When we looked at 1,000 individuals with central auditory processing challenges seen at the foundation, their average understanding in a minimally noisy environment, so what others might consider quiet, was 60%. So we would never ask students to learn from textbooks that are missing 40% of the information, but that's what a lot of students are doing with their listening all day, and it's just not fair to them. With the filter, their average understanding in this group of 1,000 went up to 86%, which is huge. 80% and above is within the range of normal performance for this task. And so that's why, we recommend the filter if testing shows that it's helpful, because it's actually something an individual can do to help improve the efficiency of their auditory system during the day. An FM system can be great. Not all schools have them. Some students find them cumbersome. So I always encourage teachers to use it if it's a classroom FM system, or some of our students have tried them before coming and they love the FM system and they can use the filter in conjunction. There are commercially available therapies that claim to change the central auditory nervous system. My colleague and I both came from therapy centers. And while I saw a lot of great benefits with therapies in terms of language, anxiety, just feeling better overall, individuals were still coming back and saying that they still couldn't understand and focus in background noise. Now, interestingly, we also looked at the average understanding in quiet in a group of individuals that had completed auditory therapy before coming to the foundation. Their understanding was still 60%, the same as that 1,000 group. So I'm a huge fan of therapies because we know that they can have benefits in other areas, just as long as we're not pulling back on the auditory supports for that kiddo and not expecting that kiddo to be able to sit and focus and understand in background noise. Hearing aids sometimes are tried, low gain hearing aids. We're still amplifying a system that's already overloaded. So some individuals we hear have done okay. Our clients that have found us have tried hearing aids and have just reported they hear the circuitry noise. It makes everything louder. They're more overwhelmed. So hearing aids are certainly something that you can explore. I don't discourage families from exploring those if that's what feels good to you. It's just, again, another option. We have not seen a hearing aid outperform the filter at the foundation, but it does appear for some that they're helpful. So, that's an option that's available.
You've described so many different options. I think it's neat that there's multifaceted approach to addressing this. So it's not just any one, excuse me, hearing aids, FM system, environmental modifications, therapy, of course, the filter. And then also it sounds like right there during that evaluation, you give some space to the client just to understand, hey, you've been dealing with this your entire life. This is a real thing and it really impacts you. It's not something that you can change about yourself, but you can address it. You can support it, mitigate it through some of these other approaches. So that has to feel really good to clients to hear that as well.
It does. Information is powerful. It all starts there, right? We can't serve these students and adults as well as maybe we want to if we don't have some information behind it. And so it does feel really good to finally have some objective data to look at, okay, this is exactly what your system's doing. And then again, transfer that information into how that individual is feeling and performing in their environments. And again, validating them and also really helping them understand that it doesn't have to be so hard moving forward. If we can do X, Y, Z and ask teachers to be a part of the team and do some of these supports at home. And if the child does their part and where's the filter, it's a big team approach. I say the child's the most important part of the team in this case, but if everybody does their part, it should result in life being a lot easier for that individual with CAPD. And that's pretty awesome.
And the child can learn those lessons and apply them
Yeah.
throughout their life too. They'll know what it is that they need to ask for in terms of accommodations or permissions. They'll know where they need to sit in a room or what environments are going to be challenging for them. I know one of the points, just a selfish little plug here, when we met with you, that sound discrimination piece that you described, that really resonated with me. And it really explained to me why when I go out into restaurants or noisy environments, why it's hard to connect. And your explanation of auditory processing disorder really made sense to me. It explained it in a way that it's like, okay, if you know you're struggling with something and you're aware of that, you can forgive yourself a little bit, and then you can also take some steps to mitigate it as well. So,
Yeah, I've had, adults especially, call this auditory chaos, which I think is a great way to, understand it, especially maybe if you don't live in auditory chaos, you can appreciate that would be very frustrating and hard. But I think too, it empowers us to maybe go to a restaurant and say, this is too noisy. Can we do carry out and take this home so I can understand you and I can have a meaningful conversation with you? And same with kids, they learn to speak up for themselves because they have the information. Sometimes when it's your normal, you think everybody's working as hard as you and you don't always speak up. So we've had kiddos learn to say at parades or birthday parties, things like that, Mom, my ears are tired. I'm going to go step outside. Or, can we leave? Things like that. Just making some really good choices to give their system a break and help them not get so saturated and fatigued during the day.
of course. Yeah, when we hear about behavior problems arising primarily in music class or PE or whatever, it's kind of a little voice goes off in our heads thinking, oh, this might be an auditory processing issue, just like you described. I have two other questions, and then you're welcome to talk about anything else that you would like to share. What would you tell providers who may be listening, counselors, physicians, teachers? You've described some of the soft signs. When might they think about a referral for an auditory processing disorder evaluation? Do you have any thoughts around that?
I think the behaviors are really the best tools we have initially to guide us whether a CAPD assessment would be appropriate. Is that child performing to potential? We don't see bad kids, I say. We see exhausted and frustrated kiddos. So when we're working with or we know an individual ourselves that just seems to be more exhausted, overloaded, frustrated than they should be, it's usually a telltale sign something's there, and to start investigate like what's on this kiddo's plate all day that's making their life so much harder. Again, those top 10 behaviors for CAPD, really, it's what we rely on when we talk to families, more behaviors too, but tell me what's going on. Again, how do they do one-on-one versus group situations? What are they reporting? Kids are sometimes the best source of information. They're coming home and saying, I can't hear my teacher. the hearing test is fine, but what they really mean is I can't separate the teacher's voice out from all the other noises. I just can't focus on it. So children are a great source of information, but the behaviors initially, I wish there was something better, like a good screener, but unfortunately there's not. But I say listen to the kids. They often tell us everything we need to know, and behavior is communication. So if the behavior is ramping up in gym and the cafeteria, or they're coming home with tons of work still to do, or they're saying, you never said that, things like that, a lot of times they're giving us some really good clues. We as adults just have to connect the dots and figure out, where they're trying to guide us. But that's hard because of all the overlap with so many pieces. But, good understanding of CAPD is needed and really crucial for many individuals. And I feel like over the years that understanding it is improving, which I'm very grateful for.
Yeah, that is so well put. I know that has to resonate with anyone who's listening to this. Just to round out the conversation, are there any common myths or misconceptions that you hear in your field that you just want to address right away, or kind of put to bed around
Yeah.
APD? Anything that you hear that you think, oh gosh, I wish that wasn't said or that wasn't shared. Is there anything that we haven't touched on already?
Yeah, sometimes we hear that parents have been told, there's nothing you can do, which is not true. It's like telling a child that glasses or contacts aren't an option. You just have to not see the board. There's lots of easy things too that we can do for CAPD. And we hear it all the time. Families are told you have CAPD, there's nothing you can do. That's not true. Sometimes our families have been told CAPD is not a big deal. It can really affect an individual's quality of life. It is a big deal. We don't get a break from the noises. If the noises are in our bubble all day, 24 hours a day, 7 days a week, that's a big deal. Andrew, if you stub your toe mildly 50 times a day for 40 years of your life, and I say, well, it's mild, it's not a big deal, you're going to be like, but it's all the time, it's wearing me down, things like that. And sometimes individuals are told that you can't have CAPD if you're bright, if you're meeting academic expectations, if you're successful. So we get that question a lot. I was told my child can't have CAPD because they're bright. And I'll say, well, would we say that your child doesn't need glasses because they're bright? It has nothing to do with cognitive potential. That's a big myth out there too.
Great point.
Yeah, so those are the three big ones we hear a lot. So yes, there's something we can do. It's independent of other capabilities. And for many of our students, it's a big piece of their puzzle. It might not be the only piece, but it is a piece.
For parents who are listening, or maybe for teachers or providers who are thinking about either themselves or a child they work with, and they're thinking it would be really helpful to get a consultation or an evaluation with Able Kids Foundation, what are the steps? What do they need to do? Do they need a referral?
Not unless their insurance requires it. So we are private pay. We don't require a referral. And I think a good majority of that decision is just knowing this is so misunderstood, that we know a lot of times it's parents that are coming to this conclusion, and they're the best referral source for their child sometimes. So you don't need a referral. You can check with your insurance company ahead of time as a courtesy. We do provide codes. Our website is a wealth of information. I redid it last summer to include some resources and things like that. So that's a great place to start. And parents are always welcome to call or email with questions. You don't have to schedule to call the foundation. So if you just need some information to sit on and get a better understanding of this piece, we encourage you to do that. We want to give you the best information we can so you can make the best decision for your child, whatever that decision may be.
I remember when we reached out 10 years ago, your office was so accommodating and so helpful, so responsive to our questions. It really made a huge, huge difference. So I can personally confirm that you guys do that. It's so helpful. Um, is there anything else that you wanted to cover today? I've worked through all my questions. I think this is a fantastic overview. And is there anything you want to share or touch on before we wrap it up?
No, you hit on the main things I love to cover, Andrew. Again, I just love people to know that this is a thing. You can have really good hearing and still work harder to connect and understand in your environments. Again, I think the website has a lot of great information for parents if they're just unsure or want to learn more. And if this is a piece, just to know there are things that can be done to support that student or support that adult to level their playing field in terms of the auditory information that they're understanding during the day.
This is such a helpful discussion. As a Coloradan, we feel so fortunate that Able Kids Foundation is right here. You're just over the mountains from us, but you're close enough.
Famous.
So yeah, it's no surprise that your clients come from all over the world to consult with you and have this done. So I thank you very much for coming on. And we could have talked for another hour or 2 hours, but being respectful of your time, I just wanted to kind of allow you to share a snapshot or a sample of what you do. And I know this will be helpful to our listeners. So thank you very much.
Thank you for having me, Andrew.
That's it from us today. As always, you can find more information as well as resources on our website, individualmatters.org. We hope you'll join us at the next podcast, where we'll continue to explore topics around successful living, learning and education, and child development, and share ways to help you live a more positive and fulfilling life.
The preceding information is not intended to provide or serve as medical, clinical, or educational advice. Individual Matters is not responsible for the accuracy of guest statements. All information should be validated independently. Please consult with your doctor, mental health provider, attorney, or other appropriate professionals before making any personal decisions for yourself or those in your care.